Shruti. Yeah. She'll be presenting pattern of uveitis from Tertiary Eye Care Center among serving soldiers in a high altitude area.
Good afternoon, everyone. I'll be presenting on pattern of uveitis. So sorry. I'm audible? Okay. Yes. Thank you, sir. So I'll be presenting this under following headings: introduction, aims and methodology, results and conclusion. So uveitis is characterized not only by the inflammation of uveal tract, but also involves the adjacent structures such as retina, vitreous, and either directly or indirectly, and is prevalent all over the world. It can occur at any age, but predominantly it affects the working age group, and annual incidence of about 14 to 17 per 1 lakh population, with a peak age in 20 to 50 years. The aim of this study was to look for the pattern of clinical characteristics of uveitis in patients presenting to Tertiary Eye Care Institute, that is a zonal hospital in northern India in Srinagar, J&K. And so this was a prospective cross-sectional study of 84 eyes of 62 patients who were diagnosed between the month of July 2022 to July 2024 were analyzed, and diagnosed cases of uveitis and age group of 20 to 40 years. They were all young and healthy, and in exclusion criteria of previous ocular surgery, any ocular trauma, because we do see a lot of traumatic uveitis, so that was excluded, and other ocular diseases were excluded. So the mean age was around 30 plus or minus 3.62, and because it's only the serving soldiers, all my patients were male, and unilateral presentation was seen in 61.8% of patients, and infectious cause were detected in 19.9, and non-infectious in 23.4. So looking into the etiological classification, yes, the idiopathic definitely accounted for 79%, followed by HLA B27 positive and B51 positive in 5%, and tuberculosis in 2% of cases. And anatomical classification, yes, I did. And when I started the data, I thought anterior will be more, but in my patient profile, it was posterior uveitis is more common, followed by intermediate and anterior uveitis, and pyelouveitis was seen in 5% of the cases. To conclude, uveitis is a complex intraocular inflammatory disease. I don't know what was the antigenic response, why they presented, and the amount of severity they were presented were like, especially for anterior uveitis, they came with vision of PL positive. They had to be heli evacuated to be getting treatment at a eye center, because they used to stay in a far off winter, totally cut off place, and this is how we were managed. And diagnosis of uveitis is often challenging due to varied pathogenesis and presentations within the community, and to look out for active causes is important. Thank you. Any queries?
You had mentioned high altitude area. Where was this?
Sir, in Poonch and ahead. I was posted at 92 Base Hospital, sir, Srinagar.
Okay, Srinagar.
It's a military hospital.
Yes. Really, it's an interesting one on high altitude.
Yes.
We do not know what is the physiological and what is the
Yes, ma'am.
pathological. There is lack of literature support in that.
Yes, ma'am.
And I just wanted to ask, may not be relevant to this. If
Ma'am.
you see an high altitude retinopathy,
Yes, ma'am,
how
we do.
long does it take to disappear?
Ma'am, actually depends on what is their initial hemoglobin, viscosity, hyperviscosity syndrome they have. If they have it around anywhere above 18, we do advise for venesection, and we do get their serum APO value done. And if it's normal, fine. If not, as such, if they have, a very recent case was a multiple macular, involving the macula, multiple hemorrhages in both the eyes. So they had a vision of almost, he had come with a vision of almost only 1 meter, gross RAPD and gross visual loss. So we do have a referral system where we send the patient at the earliest, he went to a higher center. Yes.
If they have occlusive vasculitis or vasculopathy, and if they are posted in the high altitude, it's
Yes,
going to exacerbate the pathological.
Yes,
do you
ma'am.
have a system in which to?
Yes, we do. We do have a system where we when we give their opinion, they're all put in a category that it is written that they're unfit for particular altitude and they'll not be posted. They'll be employed in a place which is not a high altitude, and it'll be kept at a lower place. Right.
Thank you.
Did you rule out any other infectious etiology apart
Ma'am,
from
we do run
tuberculosis?
a battery of investigations, everything VDRL, routine investigations. It's every serving soldier. It's not like how we do it on our civil setup, like, we'll only evaluate a bilateral uveitis. No, and every patient of uveitis was evaluated with battery of including X-ray of SI joints. So we've not left anything to, not to miss out on any diagnosis. So.
But you
Yes.
could not find out.
No, ma'am. Initially, yes. In few cases, he could not, but a few, around 10, turned out to be HLA-B27 positive. But X-ray SI joint, followed by MRI, then followed by HLA-B27. That's how. What we have at our disposal, and then followed by what we don't have.
Yeah, that's a great service.
Right. Okay. Thank you.